Hello everyone, how are you? Welcome to Your Teeth, Your Health. Today, inshallah, we will talking the new subject about dentistry. Today, I will talking about fixed prosthesis, removable prosthesis, and implant. As you see here, we will talking the fixed prosthesis and implant prosthesis, removable, and a little bit I will talk about the cosmetic prosthesis. First of all, we want to know what is the prosthesis. It's prosthesis, that's mean replace missing teeth. We have a list of the prosthesis for the fixed, for example, fixed, removable, or implant prosthesis. A type of the fixed prosthesis, as you see here, we have a bridge, veneer, and crowns. A type of the fixed prosthesis according to the material, we have ceramic, metal crown, zircon, emax, and the types also of the veneers. The veneers is one of the type of the fixed prosthesis, but they have a little more of them types like a composite or ceramic veneers. The veneers also we have type of the preparation of the veneers, and the other type name is the lumineers is out of the preparation. The fixed prosthesis that we can use to the short span, that means we can use it to the long span. If we use the fixed prosthesis for the long span, we have no support for this place. That bridge, if you use it for the long span, it's be losing. Okay, now we want to know what is the veneers. The veneers is a thin layer from the fixed prosthesis, as I said, that applying in the front of the tooth, and it is needed specific cases. That's mean here not all the cases we can use for the veneers. That's mean if you have a healthy teeth, you can't use the veneers. What are the specific cases can use it for the veneers? For example, if we have the broken tooth in the front, spaces between tooth no more than 2 millimeters. That means if we have spaces more than 2 millimeters, we refer to the orthodontics. Also, if we have mild tooth crowding, that means if you have a good occlusion and no class 1 and no class 2 in the orthodontic, just the mild tooth crowding, we can use it the veneers. Also, if you have old fillings in the anterior, caries between the tooth, and internal staining that came from the specific antibiotic like tetracycline, or from the growth of the teeth like amelogenesis imperfecta that defect the enamel, and immunogenesis imperfecta that defect dentinogenesis imperfecta, that affect the dentine. Okay, as I said, that with the type of the veneers, we have fixed needed to preparations for the veneers like ceramic or composite, no needed the preparation like a no-veneer, and snap on smile also is a removable. Okay, the another types of the prosthesis is the removable prosthesis. What is the removable prosthesis? Removable prosthesis is a type of the prosthesis you use it in the long span. That means if we lose all the posterior teeth or lose a lot of the anterior teeth, that means here we can use it the removable prosthesis. That we have two types of the removable prosthesis. The complete, that means if we lose all the teeth in the tooth, all the teeth in the mouth, and the partial prosthesis. On the other hand, we can talk here about the oral implant. What is mean the oral implant? Oral implant is a type of the prosthesis inserting inside the alveolar bone by screw abutment at the crown, replace of the missing teeth. Okay, with the types of the implant, oral implant, we can use replace at the single tooth or a multiple of the tooth like fixed bridge, or overdenture if we have loosening all the tooth in the alveolar bone or in the mouth. Okay, what the type of the x-ray we use it in the oral implant? We have two main x-ray we use it in the dental implant is CBCT, as you see here, CT scan, and OBG, panoramic x-ray. Why we use it this x-ray? We use it this x-ray to know the height of the bone, the width of the bone, the anatomical of the structure of the alveolar bone, also nerves, as I said that, and we want to know also the site of the inserted of the implant. Okay, as we see here, the structure of the implant, we have crown, abutment, and screw. The abutment, we have two types of the abutment, like zirconia, or three types actually, zirconia, metallic or gold, and we have here the screw, as you see. And the crown, we have two types of the crown. We can use it by the cement or by screw. And we have a specific surgery. We can use it for the dental implant, that same as the sinus lift surgery. What that mean of the sinus lift surgery? Sinus lift surgery, we can use it that if we have we don't have space enough to insert the implant. That means after the extraction, extracted the tooth, that tooth is very near to the sinus. Okay, for the long time the bone is resorption and the sinus it growth down, so we don't have space to create the implant. We do the sinus lift surgery. That means elevated the sinus, inserted the bone graft to replace the bone resorption. After that, we inserted the implant. We can insert the implant. As you see in the picture here, as you see, the sinus is dropped. Here, space between the sinus and the alveolar bone. We can elevate the sinus, insert the bone graft. After that, inserted the implant. Okay. What is the contraindication for the oral implant? The contraindication for the oral implant, that mean not that mean we can't do it, that we can't do for oral implant with this person, but with the control it. If we control it or remove the causes for the contraindication, though we can do like what? Like uncontrolled diabetic patient, osteoporosis, blood disorder, patient using aspirin, heparin, and warfarin, pacemaker patient, heavy smoker, and bad oral hygiene. Okay. Why the implant is important? The implant is important because it saves of the alveolar bone, and we can't use the implant if you, for example, if we want to do the fixed bridge, okay, if the neighboring tooth is a health. Okay, so we can't do the implant. Okay, if the neighboring tooth is the health, we can't do the implant. That's one. We can't do the implant. So the implant is very important to save the alveolar bone. I have some advices for the prosthesis and dental implant. Before start treatment by prosthesis, we must diagnose and give the diagnose the case very well, and keep it the gum in the health first. Treatment the gum if they need it. If the gum have gingivitis, if the gum bleeding, inflamed, we must treat the gum first, cleaning the natural teeth, and after we inserted the prosthesis also, and the implant, as we tell that before. Visit the dental implant every 3 to 6 weeks to check up the cases of prosthesis. Avoid any sticky food like toffee, hard food, gum, because this type of the food help prosthesis get out. That is a type of the oral implant, as we said. Okay, I tell you that why the oral implant is important. That is our subject for today. We will give another subject inshallah next week. Thank you very much for the watching, and welcome to Your Teeth, Your Health.